We begin with the healthcare crisis growing rapidly across this country. Burnout, staff shortages, and more shutdowns in ERs and critical care. The latest this morning, 2 major hospitals sounding the alarm in Canada's biggest city. Toronto General Hospital has put out an alert for 3 of its ICUs. Officials say those units are either at bed capacity or they don't have the staff to keep the beds open. Let's bring in the CBC's Megan Fitzpatrick, who's on this story for us. She is outside SickKids Hospital in Toronto. Megan, what is the latest from SickKids on the staffing shortage there?
Well, they're saying, Hannah, that they're, like other hospitals in Ontario, struggling with a staff shortage. And at the same time, they also have patients with high acuity, they're saying. In other words, some very sick patients who need high-level care. And one of the ways SickKids is responding to this challenge is to potentially basically second members of what's called a critical care response team to potentially providing hands-on direct patient care within the ICUs. Basically, this response team normally acts as a consultation service for doctors and nurses throughout the hospital to try and prevent patients from getting into the ICU in the first place. Now, if these doctors are seconded to be providing direct patient care, it means they may not be able to respond to those consultation needs as quickly as they usually would. So an alert went out to staff about that. SickKids is saying this won't affect direct patient care. And this does sound sort of very specific to SickKids and its operations, Hannah, but we're talking about it because it's yet another example of how a hospital in Ontario is struggling with these staffing shortages and some of the techniques they're trying to use to navigate these staffing shortages. Just up the street from where I am is Toronto General Hospital. As you mentioned, another hospital that's struggling and some of its ICU operations being impacted by staffing shortages in recent days and weeks. We've heard of some emergency rooms at hospitals in Ontario that have had to close overnight, for example, because they didn't have enough staff. And just last hour, you did speak to an ER physician here in Toronto, Dr. Noor Khatib, who described just how challenging things are in the ERs that she's working in, how the lineups just to see a nurse and go through the triage process, well, those lineups are huge. And then once you are seeing some patients waiting in hallways for a long, long time before they get admitted, here's more of what she's saying about what things are like in ERs these days.
We are in a severe healthcare crisis right now, and we don't use the word crisis lightly. It is true. We have a healthcare crisis upon us, and the first thing to do is to acknowledge that there's a problem. The average wait time to get a bed is 20.1 hours. I ask patients to get admitted by the internal medicine team, and I see them again and again on my next day shift and the next day shift, and they're waiting in a hallway in the emergency department. That is not acceptable care.
So there are some firsthand descriptions of what things are like in some hospitals in the province right now. And she said, Hannah, the summer is supposed to be their slower season. And so she said she's fearful for the fall and winter when things could get even busier than they are now.
Let's talk about what the Ontario government is saying about, the doctors and nurses who are calling this a crisis.
Well, Premier Doug Ford got a lot of questions about this yesterday when he did take questions from the media, and he's saying that he acknowledged that there is a logjam, he called it, but he was maintaining that Ontarians are getting the health care that they need. And he said that the government isn't sitting back, that they are working on solutions to this and that they have been for quite some time. Measures like adding more spaces in medical schools to add more doctors to the system, helping with tuition, for example, for people interested in going into the healthcare field. Those are more longer-term solutions, but he also did outline other measures the government's taking. And he basically defended how the government is handling this crisis, as some are calling it. Let's take a listen to a bit more of Premier Ford.
Can the province and the Ministry of Health do better? We all can. But I can assure you, they aren't sitting back. There's a shortage, and these nurses have worked their backs off. The frontline healthcare workers have worked their backs off. They've taken some time off on vacation, well-deserved. But we need to make sure that we still have more nurses, more docs, more PSWs to fill those positions.
Now, that doctor we just heard from that you spoke to, Hannah, disagrees with Premier Ford, saying Ontarians are not getting the health care they need when they need it. That's not what she's seeing on the front lines. And also some of Doug Ford's critics at Queen's Park, the opposition parties, have been sounding the alarm about this too and accusing Doug Ford of downplaying the situation. And they're urging him and his government, Health Minister Sylvia Jones, to do more and to do it quickly, Hannah.
Okay, Megan, thank you so much. Megan Fitzpatrick in Toronto.